Hey everyone, and welcome to this exciting episode of Chet Chat. It's peak summertime, and all of you have written in saying, can you also tell us a little bit about how to take care of ourselves and get ready for our admissions and job interviews whenever they come up? So today we're doing a two-part series with Dr. Amit Karkhanis, who spearheads the Twacha Clinic. And part one of this series is how to keep your skin healthy. And part two is to give you tips to have healthy hair. So join me in welcoming Dr. Amit Karkhanis. Dr. Karkhanis, welcome to Chet Chat.
Thank you.
And thank you so much for being with us today.
Thank you. Yes.
We've got these young students watching the show, and a lot of concerns they have about they want to look good, they want to look good for a long period of time. So let's start by asking you, what do you think are some of the top mistakes they're probably making with their skin right now?
Thank you so much for having me on the show. And so the basic things, and especially at a young age, when you start taking care of your skin properly, it always helps you so much future on in life. One of the basic, most simple things which you can do with your skin, which people normally might not, is one is sunscreen.
Right.
So sunscreen, I think, is something which is the most basic thing which you should do to take care of your skin. So between 9 to 5, 20 minutes before you go out is always when you should apply a sunscreen. So sunscreen, if you just apply and go out immediately, it doesn't help so much. So you should always apply it 20 minutes before you go out.
Right.
That's the first thing. Secondly, even washing your face too many times during a day is not very good for your skin, because it essentially dries up the natural oils which you have on the skin.
Right.
So ideally, we suggest not to wash more than twice a day unless really required. And if you have to wash it more than that, it probably makes sense to just use water and just wash it away.
Right.
Also, rubbing your face too much is not very good. So ideally, patting it dry would always work much better on the skin. Also, too much exfoliation is something to be avoided. So possibly once a week, if you exfoliate your skin, that is good enough. If you do it too many times, so you're trying to change the natural way the skin progresses. So it's something to be avoided.
Okay.
So I think there's a few things. Another thing is moisturization. So especially if you have a dry skin, and with a moisturizer, it only works if your skin is hydrated. So if you apply moisturizer on a skin which is very dry, it doesn't really work.
Right.
So a skin, especially when you wash your face, pat it dry, it should be a little moist, and on that you apply a moisturizer. Only then a moisturizer works.
Okay.
And moisturization is again one of the most basic things which you can do for your skin, and something which will really keep your skin good in the long term.
Right. In fact, on that topic, some people with oily faces feel that they don't need moisturization. And what do you feel about that?
So, people who are blessed with oily skin actually tend to have a much better skin in the future as well, because aging normally happens more in a dry skin as compared to an oily skin. A moisturizer always has to be used, and you have today specialized moisturizers which are meant for oily skin or for dry skin.
Right.
If you have a T-zone kind of a skin, or you have an overall oily skin or a dry skin, there is some customization which needs to be done so that can be handled properly.
Okay. I think that was fantastic, Doctor. There's one other concern, because they're young students, is acne. And they're constantly posing questions about how do we proactively sort of prevent acne, and how do we treat it once it's arrived.
Sure. So acne is something which is again linked to the oil production on the skin. So when you undergo certain changes at certain ages, the oil production of the skin tends to increase. When that happens, if it happens at a rate which is faster than normal and your skin is not used to it, if the oil gets blocked, so then it leads to an acne formation. Whenever there's an overproduction of the same oil, so then there's a clogging which happens at the pore, and then the bacteria might set in over there and form the acne to form like a pus or something like that.
Right.
Vitamin A sometimes helps to to normalize the oil production as well. The main thing about acne which I would suggest to students is you should never break it, or you should never try and press the pus out or something like that, because when you do that, you tend to also push a bit of it inside, and that's what leads to acne scars. So how much you leave it alone, especially, and try and not touch it, because I know it could be a disturbing thing, especially at that age, but how much you would tend to leave it alone would always help you a lot. So you can go and visit a doctor if needed, or you can use some drying products on the face which would also help you. So more you leave it alone, more it will settle off naturally as your age progresses.
Better, right. You mentioned scars, and that's the next question I wanted to ask you. Scars as well as pigmentation. How do you deal with that is another challenge for people.
Right. So scars tend to normally happen. So you might have something like acne scars is something which is very common in people. So that happens if you again, as I said, if you tend to touch the skin very less, it will always lead to less scars on the face. Secondly, pigmentation. So pigmentation is again linked to your sun exposure to a large extent. So how much you avoid the sun or you take adequate sun protection, you would prevent pigmentation from developing on the face.
Right.
Well, you can go visit your doctor, and maybe they can suggest some creams or some products like glycolic acid, or you have some very simple products which can be used at night, which basically will exfoliate the skin and help the skin to get better. Whenever you treat it for pigmentation or anything similar, obviously sun protection always comes into play. So later on you have to take adequate sun protection.
So doctor, you mentioned glycolic acid, and earlier you also mentioned vitamin A.
Right.
And retinol is another product that's being talked about. So how should some of these products be used by the students?
So normally, these products are something which keeps exfoliating the skin at a very minimal level, again depending on the kind of products which you use. So there are different concentrations of these products, especially when you go to a medical shop or something and purchase it. But essentially the principle is very simple, that the top layers of the skin which you see are the dead skin layers. You want to exfoliate that minimally and slowly, so then the healthy layers of skin are seen out.
Right.
And as the skin layers go on exfoliating due to the use of these products, you want to protect the new layers which are then seen. So as you protect the new layers, then the skin will start glowing, will start looking a lot fresher.
Right.
So essentially at night is when you apply, because you want the exfoliation to happen at night, and then you want to protect it during the day.
Right.
So ideally glycolic or retinol acid are not used in the daytime, they are used in the night time.
Right.
Say someone can take like a 1 fingertip unit and just dab it on the different parts of the face and then apply it overall on the whole face. So that would help the skin to remain even, to remain one tone, and to maintain the skin as well.
Okay.
Again, salicylic acid face washes is something which is used especially for people suffering from acne. That's something which can help to control the acne to some extent.
Okay. Another concern, doctor, is aging. Everyone wants to look young forever. And one of the first signs of aging tends to be lines around the eyes or lines on the face, fine lines. So any recommendations you would want to give us for that?
So, again, products like retinol and like glycolic acid help at the most minimal level to prevent fine lines from coming on the face. You do have certain professional treatments as well now in Botox and in fillers, which can be done to maintain a younger looking face. A lot of people might come and ask you, what is the right age that I should do Botox or I should do fillers about?
Right.
But more than age, it really depends from an individual to an individual at what age they should ideally start.
Right.
So Botox is essentially for relaxation of muscles, and fillers is to fill up the volume which is lost with age. So as you age, there are certain lines which come on the face. For example, the most common indication will be something called crow's feet,
Right.
which come around the eyes. Or you have the frown lines which come, in this area, or you have the forehead lines. So, or you also have a volume loss. So your cheeks might go down in volume. The space under the eyes starts to go down. Your nasolabial lines start to get a lot more prominent. So you fill those lines. So now with fillers, we can, customize a face, or we can make those slight additional adjustments which might be required.
Okay, and talking about Botox, since you mentioned it is a muscle relaxant and sort of also known as a paralytic. So how safe is this for someone as young as 20 and 30 like you mentioned?
So as I said, it depends on the lines. At what age you would start? I mean, normally if someone is a normal client, we would say a post 30 is something where you look at Botox. But in certain indications, like even, if you have excessive sweating on the hands or in the arms, armpits, so Botox is also used for that.
Okay.
So it is used for medical conditions as well.
Right.
It's extremely safe. So in the right areas when you give it, and the right doses, because earlier on when Botox came, so it was given at very high doses by some doctors, which made like a plastic face appear or something like that. So it's not like that at all today. So just the right dose at the right places would always help you to get a good result. Again, the effect of Botox lasts for 4 months. Worldwide, anywhere you do it, it doesn't last more than 4 months. So by chance, if someone injects at a wrong place, which might just happen because anatomy of every face is different, the side effect would last for around 4 months and it will go away. But again, it's a very rare thing to get that kind of a thing.
So doctor, there's some other procedures as well that we read about quite often these days, like chemical peels, there's laser treatments, there's microdermabrasion. So would you tell us a little bit about the pros and cons of some of these and the safety aspects of these as well?
So as in most treatments, with the right advice and the right laser being used, most of the treatments are extremely safe. To understand what a laser actually is, a laser is a beam of light. So like you have this light over here, a laser is just one wavelength of light, which is again customized for different things. So you might have a 532 nanometer laser, you might have a 810 nanometer laser, so it's all different wavelengths of light, and those wavelengths of light, when given on skin, the skin reacts in different ways. A simple principle of the laser is that, a laser always normally is attracted towards a dark object. Mm-hmm. So how much darker an object is, how much thicker an object is, a laser light goes more towards that.
Okay.
For example, the most common thing where a laser would possibly be used in the cosmetic arena would be laser hair removal. So always darker the hair, thicker the hair, better the results. So for example, underarms is one area where you would always have the best results for a laser hair removal. So that's a simple principle. So again, if someone uses a wrong laser to do a wrong thing, or the energy parameters are not set properly, then you might have some certain side effects.
Right.
Microdermabrasion is something which is a very simple treatment. It's just a form of a medical scrub which is actually done. In fact, today the use of that has gone down quite a bit, because it's something which gives a temporary effect for 3 or 5 days, and then that effect tends to go down.
Okay.
But you have chemical peels which are very good for also maintaining your skin. So where chemical peels are concerned, you have glycolic acid, you have salicylic acid, which are again for different things. So you have alpha hydroxy acids, you have beta hydroxy acids. So it's something which is made from sugarcane. So it is just the percentage of the concentration of the acid which varies, but at some percentages they're extremely safe to use. So again, depending on if you have acne on the skin, you have different peels which are used. If you have pigmentation on the face, then you might use some certain different peels. So depending on the kind of condition, the peels are customized, and then we can use those. Again, lasers are used for scars as well. They're used for pigmentation. They're used for hair growth also today. So you have different lasers used for different things.
Okay. Let's also talk about something they can do at home, which is their nutrition. And it's sort of going to be the base for them going forward. So what do you recommend should be good nutrition for them to keep their skin healthy for the long term?
So a balanced diet always helps, because the skin is the largest organ of the body. So how regular your diet is generally would always help you to have a good looking skin, to have good hair as well. So it requires proteins, it requires fats, it requires carbohydrates, it requires everything to maintain it. Apart from that, still if you have some nutritional deficiencies, you might need to take certain supplements. Also, when you do supplements, it is not about taking the same supplement every day. So there are some cyclical patterns in which a doctor might suggest you to take certain medicines. So you just get the adequate dose which is required for those number of days, and you are not taking excess of anything, because it's not even good to just take tablets as in when you feel like. So because even excess of anything is not good for the body.
Tell me, it's peak summer right now, and is there any quick tip you'd like to give them to keep their skin healthy in the summer?
So I think sun protection is the main
Right.
and the most simple thing which they must do. Between 9 to 5, as I mentioned, 20 minutes before they go out. Also, hydration is very important. So adequate water intake, at least 3 to 4 liters of water a day, if not more, would always help to keep the skin refreshed. As I said earlier, skin is the largest organ of the body, and any nutritional deficiencies is also seen on the skin first. So how much those simple things are done by them properly, that would always help to have a good glowing skin for the future.
Thank you so much, Doctor. That was
Thank you.
really nice, and we're looking forward to part 2 of this series
Sure.
quickly.
Okay.
But thank you for sharing this with us.
Thank you so much.
And thanks for watching part 1 of our 2-part series. Don't forget to tune in for part 2, which will come up shortly, on how to keep your hair healthy. Thank you for watching till the end, and I'm sure you have a lot of questions to ask me. You want to ask Dr. Karkhanis some questions? Put everything down in the comment section under the video. Don't forget that bell icon and the subscribe button, and like us at Facebook at ChetChat101, at Twitter at ChetChat101, and at Instagram at ChetChat101. And happy watching!